Welcome to the Modern Patient Experience, a show about how U.S. healthcare is adapting to new patient expectations. I'm James Furbush, Director of Marketing at Access One, a company that empowers revenue cycle teams to help all patients effortlessly pay for care in full or over time. In each episode of this show, I interview executives from hospitals and health systems, physicians and nurse leaders, digital health pioneers, and others to better understand what it means to be truly patient-centric. The goal is to serve up new ideas, frameworks, and tactics that will help your organization give your patients the best clinical, financial, and operational experience. And away we go. Hello, welcome back to this week's episode of the Modern Patient Experience. I'm your host, James Furbush. My guest this week, really excited to have him on. He is Reed Liggin, former founder and CEO of Razor Health, which was EHR that was sold to Athena Health a few years ago. He's back now with Sliced Healthcare, and that is, I'll let him tell you more about that, but I think what they're doing is really cool. Reed, welcome to the show. Thanks for joining.
Thanks for having me, James.
Yeah. And Reed, I was hesitant to call you the, rural healthcare community hospital whisperer, but you've been in that space for a while, certainly with Razor, now with Sliced. I'd love to just hear a little bit more about sort of your background, what you're up to at Sliced Healthcare, and then go from there.
Yeah, I appreciate that. You just shorten it to Sliced Health. It's really a throwback to a couple of things. Throwback to Razor Insights, since a lot of people knew us from that name in the industry.
Yeah.
But also because we slice and dice data. We're a data automation company, and we really learned the community hospital space at Razor Insights really well. As you said, it was a community hospital EHR, and we had a really quick ride from 2010 to 2015 and sold the company in January 2015 to Athena Health. We've gotten the band back together, so to speak. So a lot of our original team members that worked at Razor Insights have joined back together here at Sliced Health. And we are taking all sorts of data, mainly financial data, but we've also started to delve into the clinical realm as well. And we're slicing and dicing data. And we really started out just before the pandemic in a fairly timely manner, which has made it a little slow to get out of the gate. We started taking financial data, and we built business intelligence for community hospitals initially, and then basically built business intelligence dashboards by analyzing that financial data and giving community hospitals the ability to see how they were performing in a variety of areas around their revenue cycle. Denials management, how their providers and payers are performing, and really a lot of other areas around their whole revenue cycle to show them how they're performing in a dashboard format. From there, we also built price transparency to show community hospitals how they could perform, could meet the federal guidelines around price transparency and make sure they meet those measures. And then after that, just this year, we came out with payer contract management, give community hospitals the ability to find money that they were being paid by commercial payers. And so that's been a really big hit to actually show community hospitals real money that they were being underpaid. We're finding 9% of commercial payer payments are underpaid community hospitals. So there's real dollars there. So we're really excited about that. And it's all a single SaaS platform in the cloud. And we charge a low monthly subscription fee, get everybody live really fast. And there are no implementation fees with our model.
That's awesome. I'm sure your customers are probably excited too, because I think one of the interesting things about your career as an entrepreneur and, creating companies in the healthcare space is equipping really sections of the market that don't necessarily have the resources, or maybe have less resources to be able to and I don't want to like how to express it in some ways because I don't want to make it sound like those healthcare providers are not doing as well of a job, but they have a tough job, right? Because, rural healthcare has certain challenges in terms of resources, payer contracts, patient volumes, you name it. And if they're not tied to a large health system, they probably don't have as much money to spend on tech and fancy things for their patients. So they have to really get the basics right. And I think I admire that about you, which is like you're trying to almost level the playing field in some ways.
Yeah, we are. It's interesting. I worked in the beginning of my career. I'm a pharmacist. I started out, working in hospitals as a pharmacist. I worked for some community hospitals, so I saw what went on inside the walls of those hospitals. I grew up in a really small town in Georgia, so I had a passion for community hospitals. But then when I got out of hospital pharmacy and actually worked in the health IT business, I worked for McKesson and I called on large IDNs and large academic medical centers. And so I really had no interest in going and selling into this hospital world, in the community hospital world. The big dollars and the big money as a salesperson were large deals selling to the big IDNs. And so it was interesting when I became an entrepreneur, I decided to go and sell to this underserved market. One, because there was a lot of blue ocean there. Not a lot of people were building products and selling to that market, but also I had a passion for, building technology and delivering SaaS products to that market because I felt like they deserved technology that was on par with everybody else and they had really been underserved. But what I also found was they are underserved, and while they don't have the resources the rest of the market does, they're doing a lot with the resources they have. And so you find some really talented people that are doing a lot with without a lot. And so they're making the most of every dollar they have. And so you find some really amazing people that are doing great things in that market.
Yeah.
And so we also likewise had to do a lot with a little, and thanks to companies like Google and Microsoft and Amazon as the platform we're on, you're able as an entrepreneur to take advantage of these new platforms they offer and deliver to this market in a way that you couldn't, 10 years ago. And so we built everything on the AWS platform. We're pretty proud of that. And we're able to deliver great products to this market at a very low cost. And so starting with Razor Insights, I led another company in the e-prescribing space and then moved to this space. We're able to deliver products that are inexpensive, only cost a low monthly subscription fee, but deliver a lot of value and a great ROI for a great return. Actually, what I'm most proud of about Sliced Contracts and Sliced Insights and Sliced Pricer, the three products we deliver, is there's real hard dollar ROI that comes back into the pockets of our clients as a result of the products we deliver to them. So we're really excited about that. We are really excited about where we're heading in 2023 as we continue to refine our products and make them better and prove out what we're doing in the market for these clients.
Yeah, that's awesome. Are you, so as you're going out to the market and talking to these customers, I mean, what are you seeing as their biggest patient experience challenges, for this segment of the market? I think the last couple of years in healthcare, US healthcare in particular, has been a challenge across the board with, patient volumes and labor shortages and COVID and, you name it. But specific to that, market that you're serving, community access hospitals, rural practices and things like that. What are some of the challenges that you're seeing specific to them?
Interesting. When I first went into this market, there was a real resistance to any kind of discussions about patient experience. And it was really dismissed, but you would go into the waiting room and you would see a lot of people waiting in these hospitals. sitting around waiting on a registration person to manually put in their information and people writing on paper clipboards. But then you would also see those patients sitting there on their mobile phone, and you would talk to the CEO or the CFO or the person who's in charge of patient registration, and you would have conversations with them and they would say, our patients just don't respond to mobile. They're not very tech savvy. And you're like, but I just walked through the waiting room and I saw a lot of people on their phone. Every single person in your parking lot, in your waiting room, had a mobile phone and they were on it while they were waiting to be seen. And you had a big backlog of patients. And when the pandemic happened, they were forced to confront that, and they were forced to start to deal with patients in a new way because they couldn't come and sit in the waiting room. And so slowly but surely, there's a realization that they had to start to deal with the patients in a new way. And so there started to be a realization even in the rural market, which I think is really the last mile, that this is possible. And so there's started to be an acceptance, but I think we're still in the show me state to a degree that in this market that it's going to work, but we are there, and things like getting your bill, over the phone through a text, those things are starting to be pretty universally accepted. I think, there's still some reticence on the behalf of management, but they're starting to get it. And I think we're starting to get there. It's still not quite as, eh, they're still not quite as on board as I'd like to see them, but we're getting there rapidly. And the fact that patients love it. And I think one of the things that hospitals and health systems and the practices that they own and manage, are having to confront this issue with is the patient responsibility of the amount of the bill that patients are having to be responsible for paying is becoming such a big part of the bill. Um, they're having to deal with it, and they're having to find ways to reach that patient and make it easy for them to pay that bill. Also, pre-registration is a big thing, and they can't have people, um, people's convenience, has become a big factor. And so those things are they're having to be dealt with in healthcare, and even in the smallest of the small towns and the most rural places in America, uh, these organizations are having to deal with it finally, and we're finally getting there. And it's finally, we're getting to a place where we're crossing that last mile. And so you're also starting to see, the high-speed internet fiber, federal programs are being pushed out that are getting, better internet out to these places. I know when we rolled out Razor Insights, we would often put, 3G, hotspot in the hospitals as backup internet. And we'd say, put this in your drug cabinet, buy you like a Verizon 3G hotspot and put it in your drug cabinet as a backup internet in case your internet goes down. People aren't having to do that anymore. There's good, reliable internet throughout most of the country now. And there's fiber going out in a lot of rural areas through some federal initiatives. And so, the internet is way better than it was a decade ago when we were rolling out Razor Insights CHR. So that's helped push this along too, because most hospitals have pretty good Wi-Fi, available for patients to connect when they come into the walls of the hospital as well. So a lot of comments there, but hopefully,
No, it's great because I think, it's always funny to me when anywhere gets pushed back. It's like, our patients are too old and won't use a mobile phone, or, in the case for you, it's like, we're in like rural America, our patients are doing this. And it's like, man, like computers have been around for like 30, like my mom, she's 74, God bless her, but she's been using computers for 40 years. Like even like when we say like quote unquote, like old people don't use computers, it's like maybe like someone who's 90, but like I think the large majority, it's like, no, like mobile everywhere. Everyone's used computers. People know how Google works now. It feels like sometimes it's just an excuse to not have to do like lift a finger to make like necessary changes and adapt to the times that we do in fact live in. But it is funny to think, 5, 6 years ago, having to bring a 3G hotspot to a place, that feels like a whole other different world. Like having to be like, here's a 3G hotspot, which I don't even know when the last 3G cell phone.
I know
Uh,
it's a blast from the past, but that was a reality we dealt with a decade ago. Now we don't have to worry about it anymore. And so, the great thing is too, you can go in and have a conversation with the CEO and say, we know, when you talk to everybody's mom, just about knows how to text, or grandma knows how to text. The older generation has all gone to Facebook. The younger generation has moved off of Facebook and has gone to Snapchat and TikTok. And so, or whatever else is out there. And our kids probably don't tell us about. But there's certainly, a high social element of mobile phone usage, and people have these things. And so, we need to be using these things in healthcare too, because that's a convenience for people. So if you need people to pre-register, register, pay their bill, these are great ways to make it convenient for people to do those things in healthcare.
yeah. And bringing that convenience to patients, what's the trickle down for these organizations? Does it make them more efficient? How? Because I would think for a lot of these facilities too, which they're under constant pressure of closing and having the funds to stay open and things like that. But do you have a sense of what is that sort of trickle down when they can get their hands on better technology, more convenience for their patients, things like sliced, BI tools and things like that? What does that bring to these facilities in terms of just their everyday or their kind of day to day?
We see, when we analyze their data, we see that, the hospitals that use these type of tools are capturing better revenue and performing better. And they're getting more money in the door faster. And so there's a big difference in the hospital that use these sorts of tools, like our partners at Access One. And they're having a much better capture rate on patient responsibility, which is, as we said, was becoming a much bigger part of their or their revenue every month. And so that's a big factor, but also patient responsibility is becoming a bigger part of what you need to collect every month. That, we're analyzing that data, but also we're, part of what we do in Slice Pricer is not only are we tracking, patient responsibility, we're tracking price transparency, but we're estimating patient responsibility as part of that product. So when we give estimates, we also want to give, the hospital a way for patients to pay that patient estimation as well. So you don't want to just give an estimate and then not give patient a way to pay that bill too. So we're trying to, we close that loop.
Does that help with, what's the pricing transparency laws and stuff that have come in where they have to be able to do that for patients?
Yeah. Hospitals are required now by the federal government to post their prices online as part of the federal price transparency laws. It started with President Trump and then continue with President Biden. So it's one of the very few things that is both parties agree upon. And so
not much, but
exactly, bipartisan is a rarity these days. And so basically every hospital in the country has to post their prices online on their website. And then patients, it's not a federal law that they have to give an estimate to a patient, but most hospitals are pretty much on board with giving the ability to give patients the ability to estimate what their price may be as well. So it's an extra step we added to our slice pricer product. And so we can give patients an estimate of what things may cost. And so on the back end of that, once you've gone in and had a procedure done, it's just natural that you want to give them the ability to pay for that in an
Yeah.
easy way by sending them a link and you pay the bill real quickly, especially if it's a smaller amount. If you only owe like 25 or $30, it's a really easy thing to do. It's get a text and pay for it right there on your phone with Apple Pay or something like that, or Google Pay. Whereas, if you get that bill in the mail a month later, you're a lot less likely to forget about it. So
As a parent with two small children, I can tell you how many
yeah,
healthcare bills I get that are just stacked somewhere in my house,
yeah,
just constant. And then eventually I just go into the portal and I, pay whatever and all one fell swoop. But yeah, mostly if I get the bill by paper, it's
right. If I could
just
get
like,
it on text, pay it on Apple Pay right then, and especially not a massive bill, um, so, and if it is a bigger bill, maybe you want to be able to offer that to a patient on a payment plan. And so
yeah,
some payment plans are convenient. And
yeah. Do you, do you have, I'm curious. So for a lot of these places that are facilities asked to do a lot with very little, and again, that's not different than probably a lot of other healthcare places across the country, but for here, it's probably cute because you have even less to do, even more with. But what are some like tactics and strategies that you're thinking about or would advise them related to the patient experience or just their own business for really delivering the biggest bang for the buck? It's I'm always constantly surprised when I talk to people on the show where it's like the oftentimes best solutions are just simple, practical things, almost like getting back to basics in some way, which sort of always, it shouldn't surprise you, but I guess sometimes it always does. But I'm curious for you, as you're talking to these places, you've been in the space for a while. What sort of advice do you give to them for getting the most out of the resources that they do have?
I think that's great advice. And you and I think alike in that aspect is try to keep it simple and don't overcomplicate it and find things that do deliver a lot of bang for the buck without, um, spending a fortune. Um, Try to find things that aren't super expensive, but do deliver a lot of bang for the buck. And so, things that aren't going to be a long install. And so, one of the things we like to about the solutions we deliver at Sliced Health, like our Sliced Insights business intelligence product, once we get the data from the client and it's just simple claims data that usually takes, 2 to 3 weeks to get from their clearinghouse, we can stand up their business intelligence dashboards in 2 to 3 days.
Oh,
Um,
wow.
when we get their payer contracts, we can usually have those live in 6 to 12 weeks. Traditional management systems take anywhere from 6 months to 2 years. We a very disruptive process as far as
Yeah.
how to do that. And there's a lot of machine learning under the hood in the engine we built, so we're able to do things a lot more rapidly. Um, with price transparency, once they're charge master, we can typically have them loaded probably in 3 to 4 weeks. So very short, rapid time frames. And so we tend to partner with companies that deliver in the same way, where we can get, um, you know, mobile pay up with a partner in just a few weeks. And so we, that's why we chose to work with Access One in that partnership. And so we, we tend to like to find partnerships and recommend companies that can get our clients live in a rapid way, just like we can.
Yeah, it's funny how nowadays too, the days of long installs should be a thing of the past. Like doing like contract management and you're like, oh, it's up and running in like 2 years. It's like by the time you get up and running, it's like it's already irrelevant in some ways, or like
Some of those products don't work great, but we try to deliver the fast time to value. And then we think in this market, in this community hospital market, it means a lot more than it does other places because they're fighting for viability. And so 2 years from now could be the difference between some of these hospitals teetering over the brink of surviving, right? So you can get things live fast and help them get money in the door. That could be the difference between surviving and not surviving, or somebody's job or not. And so we think that's why it matters so much.
doesn't, especially for a lot of these facilities, it's like not only the difference between being open and closed, but then like for a lot of patients, it is the difference between having a facility that is like within like life-saving distance versus having to drive 4 hours, whatever that is, to the next nearest facility, where by then it's like too late if you have a heart attack or whatever that, where you need immediate medical attention. And so it for some of these places being open, it is the lifeblood of the community, the only care facility for, next to maybe Walmart Health or something. It's very, these places, that geographic distance can be pretty bad for, some of these communities.
Yeah. A community hospital is really vital to a community. We've seen past when community hospitals close up, how detrimental that can be to a community's survival in a lot of ways. And so um, we want to make sure that we help these community hospitals survive and thrive and help their communities continue to be viable. And so we want to play a role in that.
Yeah. Do you have a sense too, like, does it matter if these facilities stay independent or if they partner with a larger, affiliate with a larger, because the mergers and all of that, the consolidation in the market obviously is obviously been a big trend in healthcare we'll just say the last decade.
It's important for them to stay independent. We feel like when they do tend to merge into larger organizations, um, a lot of the identity they have in their community, they lose. And also a lot of the high level care that they provide in their community, they send off to the bigger city. And so, it just seems to take a lot of the soul out of those health systems. And so, we think it's important for them to stay, independent. And there are probably in the under 200 bed hospital space, there's a couple thousand hospitals in the United States that are still independent community hospitals that we want to see. We want to help continue to survive and thrive, as we say.
Yeah. And especially in the past decade where it's like over 100
Yeah.
have closed. The number of like small rural community hospitals that have closed in the last, you know, like last decade and change it's staggering, when you look at it. So, are there reasons for optimism then? It sounds like there are. I'd love to, um, sort of end,
We can help at Sliced Health. I think, one a couple of things we learned at Razor Insights, a couple of the reasons we started this company at Sliced Health, we saw hospitals that were struggling, one, to get their hands around their data to make sure that they were on top of their business performance.
yeah.
We would see hospitals that were doing things in spreadsheets and doing things manually, and they didn't have the resources to go out and hire business analysts or buy business intelligence tools like Tableau or Looker or, their core vendor offered tools that they were not, they weren't out of the box built. They had to, configure them themselves. And so they were doing things manually and taking them to the board, and they would go to the board with, you know, 30, 60, 90-day old data. And so they're always operating behind the 8 ball and using old data to tell their story to the board. With our tool, we really become their analytics as a service team and basically become their analyst for them and basically become like a remote analytics team. And so we deliver their analytics served up every day, ready to consume. And so they're always on top of how they're performing financially. And as we evolve this year, we're going to start doing more clinical analytics as well and helping them stay on top of that sort of thing. And then as we get into contract management, we'll be able to, as we've rolled that out this year, we can actually help them find money that's owed to them and improve their bottom line really fast. And so making sure that they get every penny that's owed to them and make sure that they're collecting all the money that they should be collecting. And that tends to run in the hundreds of thousands of dollars. Sometimes in some cases, if we're doing a lot of high dollar surgeries, it can be in the millions of dollars. And so there's a lot of money that hospitals need to be collecting that they're not. We find it in every case. And like I said, we're averaging 9% of expected payments that commercial payers are underpaying our community hospitals across America. So we're here to help. We can make a difference. And then also making sure that they're compliant with the price transparency laws and making sure they don't get fined for those, because there are fines and the government's starting to step up enforcement this year. So we're here to help, and we'll do it at an affordable price that we'll make sure that we'll just charge them a little bit of a fair price and make sure that they make a lot more money on our platform than they'll ever pay us. And so it's a win-win for everybody.
That's awesome. Reed, it's been great having you on. Where can people go to learn more about you and Sliced Health? How can they get in touch or follow along on your journey?
Yeah, it's slicedhealth.com. And you can go explore our website, learn about our company. We're also on LinkedIn, and we're on Twitter as well. And then when you go to slicedhealth.com, if you want to just get a quick overview of the product, you can click on the top right corner and book a demo right in Calendly. It's hard to say. And you can do a demo right in our calendars. And so we're ready to show you what we do right away on the web anytime.
Awesome. Well, Reed, thanks so much for joining the show. Love chatting with you about rural health and what you're up to. So thanks for making the time, and look forward to staying in touch.
Thank you, James. Take care.
All right. Take care.